President Joe Biden is vaccinated and boosted, but yesterday we learned he tested positive for COVID. Dr. Syra Madad, infectious disease epidemiologist at Harvard's Belfer Center for Science and International Affairs and the NYC Hospital System, joins us to talk more about miscommunication in vaccines. Good morning, Dr. Madad. Thank you so much for spending some time with us today.
Good morning. Thanks for having me on.
Let's just get right to it. What is the number one misunderstanding about COVID vaccinations and boosters?
Yeah, so, COVID vaccinations are exactly what they're intended to do, which means it's keeping people out of the hospital and dying if you're up to date with your vaccinations. And so when we look at President Joe Biden, he is, not only vaccinated with his primary series, he's boosted twice. And unfortunately, he did get infected with COVID-19, which speaks more to the high levels of a virus that's circulating in our communities. In fact, over 90% of all U.S. counties have very high levels of COVID-19 transmission right now, the virus that causes COVID-19. But if you look at President Joe Biden's story, it's a teachable moment, as the Washington Post puts it, because it shows that we are in a period of the pandemic where the disease is manageable. We have tools, we have vaccines that are keeping him out of the hospital. And he started his antiviral dose of Paxlovid, which, with taking it in the first few days of infection, reduces your risk of hospitalization and dying by 90%. So we're in a very different period now.
Yeah, he is the second president to have gotten the virus. We know that President Donald Trump got it at the very onset of COVID-19, onset of the pandemic, when we did not have a rapid availability to vaccines. As you say, Mr. Biden in a very different position. Still, he is 79 years old. That's the age of my mother, has underlying health conditions. If my mother or father had tested positive for COVID-19, they are ages 79 and 82, relatively healthy, I would still be concerned because of their age. They are in a vulnerable population. I know you're not the president's physician, nor do you have access to that information, but as a medical professional, do you think that we should be concerned?
I think certainly, when you have elderly getting infected, whether it's the president or not the president, that doesn't really matter. It certainly is a concern. But I think given the fact that he's taking Paxlovid early on, it gives a little bit of assurance that, he's going to be protected against the worst outcomes, which is hospitalization and death. But certainly there's no, there's nothing to say that he may not progress to severe illness, right? And that's where it's really important to continue to monitor and continue to ensure that he's doing everything that he's able to do to, make sure that he stays, fairly well and healthy, if you will. So right now he has mild symptoms, but certainly I think the number one risk factor when we talk about COVID-19 and progressing to severe illness is age, is various underlying health conditions. So it certainly does put him in that category. I think when we talk just about booster doses, and as you know, he's gotten, he's been boosted twice. If you look at the recent CDC data, adults in the U.S. who are over the age of 50 with 2 booster doses had a 4 times lower risk of dying compared to individuals that had just 1 booster dose. And so, because he's gotten that second booster dose, it also puts him, in that lower risk category of progressing to severe illness. So I think the story here, and also for just generally Americans, is that if you haven't been up to date with their vaccinations, it's important that you do so, because the virus is still circulating at very high levels in all communities.
It is a good example of how to live with the virus, so to speak, because we are in that next phase, so to speak. Dr. Syra Madad, infectious disease epidemiologist, thank you so much for taking the time to speak with us and helping us understand where we are today with COVID-19. We appreciate your time.
Thank you.